2021 American Foundation for Suicide Prevention's State Advocacy Day. We're doing things a little bit different again this year, but we're glad you all could join us virtually. 2020, what a year. A tough year for all of us. In the middle of that tough year, though, there was some pretty important policy work being done on the federal level and some discussions here on the state level about how we as a community come out of this and how we restore resiliency to each other and to our communities. Guys, I'm Tyler West, and I am on the board of directors for the American Foundation for Suicide Prevention. As well, and also I serve on the National Public Policy Council, helping write and advise write legislation and advise legislators, both in DC and around the country in all 50 states. So we're going to get started here tonight. We've got a very special guest who's going to say a few words shortly. But let's start with just talking a little bit about what we're going to be doing tonight. You can expect to be here about 20 or 30 minutes, depending on how the discussion wraps up at the end. All right. Somebody give me a thumbs up if you can see the state capitol. All right, good. All right, so tonight we're going to hear from Tabitha Childers, who is the board chair for the Arkansas chapter of the American Foundation for Suicide Prevention. Obviously me, and leader Tippy McCullough from the 33rd District of Arkansas is going to talk to us a little bit about the importance of the work that we're doing and some work that she's working on as her role as a leader in the House of Representatives here in Arkansas. So tonight we are going to talk about the facts and figures. We've seen some interesting numbers over the last 2 or 3 years here in Arkansas. Not quite a trend, but we're certainly going in the right direction. Tabitha is going to talk to us about that. And then we're going to talk about Advocacy 101. How is a bill made? Where does legislation come from? And how can we be a part of that conversation? Then we're going to talk about Arkansas's public policy priorities for this general session. We've got some really exciting things that are in the works right now. I'm going to tease you a little bit, then I'm going to put you on alert to be following up watching your email here in the next few days as we get some exciting things introduced on the floor. Then we're going to talk about how to take action, how to actually set up a meeting, a phone call, a Zoom link with your members. To let them know that this legislation that's been introduced is important and we need their support. Then we're going to open it up for Q&A. That'll be the interactive part of the evening. We'll have hopefully some lively discussion. So, all right. So Leader Tippy McCullough is going to say a few words and talk about her role as one of our biggest mental health advocates in the House. Representative Tippy McCullough is serving her second term in the Arkansas House. For the 93rd General Assembly, Representative McCullough serves as the House Minority Leader. She also serves on the Legislative Joint Auditing Committee, the House Judiciary Committee, and the House City, County, and Local Affairs Committee. Representative McCullough is an educator in Little Rock. She has an associate's degree in physical education from Garland County Community College and a BSc in physical education and English from Ouachita Baptist University, as well as a master's in English from Henderson State University. She's been involved with the Arkansas Education Association Legislative Committee, the National Education Association Women's Issues Committee, and the First United Methodist Church here in Little Rock. Representative McCullough has been awarded the ACLU Champion of Liberty, a Person of the Year by the Arkansas Times, Arkansas Young Democrats Lifetime Young Democrat Award, and the Arkansas Times runner-up for Best Little Rocker. So Representative McCullough, take it away.
Thank you so much, Tyler. I appreciate that introduction. I'm so happy to join you all tonight. As Tyler said, he mentioned my background. I'm taught English and coached basketball for 33 years. So I have been all over this state, especially in my coaching career. I've been in rural areas and I've been in urban areas. So I feel like I understand a lot of what goes on all across the state. Just to tell you, because some of you, I'm assuming, are from all over the state. I taught, my first teaching job was in Kingston, Arkansas. And then I went to Newport, Arkansas. I was at Kingston 5 years, Newport 7, Mountain Pine outside of Hot Springs for 2 years. And then I finished up in Little Rock, was at Mount St. Mary for 14 years, and finished my career at Central High School here in Little Rock. So one of my experiences with suicide, and this is one of the big issues, right, that has touched everybody. Anybody you talk to has had some kind of experience with someone who committed suicide or maybe attempted. But one of my first experiences was I was a young teacher in Kingston, Arkansas, and I had a student athlete commit suicide as a 10th grader. And so this is certainly in my educational, my career as an educator has been something very important to me, and something that I've really worked hard to try to be empathetic with kids, to make sure that I watch for any signs or anything like that. And anyway, I want to let you know that your work is impossible. I mean, our work is impossible without you. If you are not participating and doing the things that you're doing today, coming to this type of thing tonight, I want to share something with you. At the Capitol right now, usually all of the groups, including you guys, would be up there in person on your day when you advocate. And I just want to tell you, you are truly missed. Your energy is missed. The educational stuff that we get from you is missed. And it really fuels a lot of what we do. And we miss you. And hopefully, by the next time we can all get together in person and everything. But it's important that you're continuing to do the work, even though we're doing it virtually this year. I just want to thank you. Your texts, your calls to legislators, your emails, handwritten letters to the editor are so important. We when I get those things, those are things I do not ignore. Those things, I read everything I get. I try to respond if I have the time, but I read everything I get. And I just want you to know that you have a big influence on legislators. They pay attention to the issues that when they're getting the most text, calls, pink slips inside the Capitol during the session, and all the other things that are going on around that. I do want to ask you to do a couple of things, though, in your communications with legislators. Please be polite and professional, no matter how passionate you are about it, because your passion can come through in so many other ways. Please make sure that you share a personal story. I can't tell you how many legislators I've heard say this time, when they just send me a form letter, I just delete it. I think they still pay attention to how many of those form letters they're getting, but I do think it's important if you can share a personal story with a legislator. I'm just telling you that has more impact than any form letter will ever have with all the stats and everything. So please share your stories with them, and please be, like I said, polite and everything. If you start out with "you're a sorry whatever," most people are going to tune you out right away. And we have had some of that. So thank you. Your work researching, testifying in committee, sharing your really personal, sometimes tragic and traumatic stories, and educating us legislators. You guys are the experts. We cannot know everything about every issue, so we depend on you greatly. I also want to thank you for supporting candidates that support this issue of suicide and suicide prevention. I want to thank you for supporting those candidates and helping them to get elected so that we can move forward and we can save lives on this issue. But I just want to thank you all once again for letting me share just a few minutes with you. And I can't express enough my gratitude for what you do, for the volunteer, for this time. There's lots of ways you could spend your time, but you're choosing to spend it this way. And we thank you for it. And I want you to know that your work is important. And thank you guys, and thank Tyler for having me tonight.
Yeah, thank you so much, Representative McCullough. I want to share with everybody, I was on the phone with Representative McCullough this morning, talking about some upcoming legislation, and it's not the first time she said it, but she said, "Thank you so much. You guys are the experts." There's a lot that comes across these legislators' desks. It's our job to let them know what's important and why it's important. And Representative McCullough, you are singing my song when you talk about telling your story. That's where our power lies. We got to make it real. We have to make it personal. So Representative McCullough, I know you've got to run. You're in the middle of a very busy session, but thank you for your time tonight, for always being there to take my calls, to return my texts, and be probably our biggest advocate on the House floor. So thank you, Representative McCullough. All right, let's see if I can share my screen again. Thumbs up. See this? Good. Okay. All right. So we are going to move on to our brave and fearless chairwoman, Madam Tabitha, is going to talk to us a little bit about the facts and figures and kind of give us a state of the union about where we are as a state with regard to suicide.
Tyler, thank you for that. Like Tyler said, my name is Tabitha Childers. I'm the chair of the Arkansas chapter of the American Foundation for Suicide Prevention. I'm also a survivor of suicide loss and the parent of a child who struggles. So this is all very personal to me, as it is to most of you here, all of you here. And I wish Representative McCullough were still on. I'd like to thank her personally, but I'll write her a note. I really appreciate her tips that she provided and her advocacy. She has been a great supporter of ours, and spoke to us last year as well. It's hard to believe that we're now a year. This is number 2 of doing this virtually. So hopefully next year we'll be back in the Capitol. But I'm going to just speak to you about speaking out about suicide and telling your story. It is very important that we use safe messaging. Our advocates for AFSP come from many different backgrounds. Some of us have lost loved ones. Some have had their own struggles or support someone that struggles. And some are professionally invested in this space through their work. So telling your story can save lives, but only if you share it safely. Sharing your story lets people know that they are not alone, and it shows them recovery is possible. If done safely, your story will encourage other people at risk to seek help. Remember, you should be in a safe place in your recovery. Avoid discussing details and method, as this may be triggering to those around you. Avoid glorifying suicide by using terms like successful attempt. Instead say completed suicide or death by suicide. And avoid using commit, as we often relate this to crimes. Instead say someone died by suicide or took their own life. Share mental health resources such as the National Suicide Prevention Lifeline or Crisis Text Line. And finally, practice. The more comfortable you are in sharing your story and talking about suicide, the more we can break the stigma associated with mental health and suicide. Tyler, we advance the slides. So the Centers for Disease Control and Prevention, sorry, I have dogs in the background. They love to join Zoom meetings. So the CDC collects and shares data on the number of suicide deaths in the United States each year. It typically takes 2 years to scrub the data and for it to be published. So the most recent data that you'll see is from 2019. Suicide remains the 10th leading cause of death in the United States. In 2019, we lost 47,511 Americans to suicide, making it the 2nd leading cause of death for those ages 10 to 34, and the 4th leading cause of death for ages 35 to 54. Over a third of those died by suicide were over the age of 55. It's estimated that for each suicide death, there are 25 attempts, and which works out to be more than 1 million attempts per year. Let that kind of sink in. 1 million attempts per year. We have that many people struggling. Next slide, Tyler. This is the part of the AFSP National Fact Sheet, and it's available at afsp.org/statistics. What you're seeing is a comparison of the suicide rates across the country. You can see that Arkansas is in the middle third of the suicide rates in the U.S. And it is important to remember that even for states in the lower third with their suicide rates, that there's still more work to be done. In 2019, we lost 548 Arkansas residents to suicide. The 2nd leading cause of death for ages 10 to 34, 4th leading cause for 35 to 54, and the 10th leading cause of death overall. Here's a copy of our state fact sheet that has been shared with each state legislator. You can view and download the state fact sheet at afsp.org/statistics and share it within your communities as well. Note, this fact sheet does have 2018 numbers. We don't have the new fact sheet with the 2019 numbers yet, although we have the data, and the slide before this reflected the 2019 data. And Tyler, I will hand it over to you. Thank you.
All right, thanks so much, Tabitha. So what we are seeing, those numbers, let me kind of give you kind of a 10,000 foot level with those numbers. Starting in 2018, we lost 555 Arkansans. In 2019, we had a decrease down to 548. And 2020 numbers are at 554 right now. So we are seeing some positive movement. These last numbers weren't great, but that's kind of what we're looking at. So it's that those numbers tell us more than ever that our work and our determination has got to be stronger and more present than ever. So thanks so much, Tabitha. So why advocacy? Why is this important? Just like Representative McCullough said, you guys, we can make a difference by having these conversations, by starting these conversations, and by making sure these conversations continue in a productive and effective way. So you guys, the field advocates, I hope everyone here watching tonight is a field advocate. If not, go to afsp/advocacy to sign up. That's afsp.com/advocacy. Wendy, if you'll put that in the chat for us. And then in 2020, AFSP field advocates engaged lawmakers across the country, seeing over 75 state suicide prevention and mental health bills become law. That does not happen by accident. It's us directing attention and directing policy work to the issue of suicide prevention in our states. We had some great federal legislation in 2020, but it all can't be done on the federal side. Some of it needs to be done right here at home, specific to our communities and our populations. So look at all this that we have and are continuing to make an impact for rural communities, crisis resources, veterans, healthcare professionals. After 2020, that's a big focus, the mental health and the resiliency of our healthcare professionals, the LGBTQ community, students, crisis lines, first responders, farmers. All of these are groups that are affected by suicide that we need to elevate in the conversation. So where does legislation come from? Representative McCullough hinted at this. Some legislation comes from the legislator themselves. Sometimes it's something that they're passionate about or they think is important. But where else does it come from? The majority of legislation comes from constituents that are reaching out to their members, to their elected officials and saying, this is important to me. Let's sit down and talk about it. And then organizations like AFSP, for pretty much any piece of anything that I recommend or we recommend to a member to be introduced for a vote, we provide model policies. And they lean on us for that. They want us to be the experts. They want us to show up, not just saying this is a problem, but here's a solution or work toward the solution. So how does a bill become a law? Whatever chamber it's introduced in, either the House or the Senate, it's introduced and then it's assigned to a committee. This is where we can do our work. We show up to that committee, we provide testimony. Some of us may want to provide written testimony to add to the record and for the committee members' review. Once it comes out of that chamber's committee, it goes to the full floor for a majority vote. If it passes that chamber, then it goes to the other chamber. So let's say it starts in the Senate, passes through Senate committee, then the full Senate floor, then the Senate passes it over to the House side where it goes through the same process. It goes and it's assigned to a committee. Guess what? That's where we can do our work. We show up and we let them know why this is good, smart, life-saving legislation. Then it goes to the floor in the House for a full vote, where it is then forwarded to the governor's desk, where he will either sign the bill allow it to become law without signature, or veto the bill. All right, connecting with lawmakers, 3 key steps, and we're going to hit on this a little bit later on about some specifics. But 3 key steps: always introduce yourself and share your connection to the cause. Just like Representative McCullough said, tell your story safely. Make sure that it's safe for you to tell your story, and make sure that it's safe for whoever you're talking to, because you never know a person's experience with suicide. Offer to be a resource. Every initial conversation I say, you know, I talk about whatever it is, you know, is on the agenda for that conversation. And the last thing I always say is, hey, I always want to be a part of this conversation. Take my card, or keep me in the loop. Offer to be a resource, and then follow through. Whenever you see legislation pertaining to suicide prevention, follow up. Send them a text message, call them. Their numbers are listed. I'll show you their office numbers anyway. I'll show you how to navigate through the Arkansas Legislature's website here shortly. If you don't know the answer to a question, it's okay. We are not professionals. We are volunteers, and it is okay if you're having a conversation with one of your elected officials and they ask you a question you don't know. Say, I don't know. That's a great question. Let me follow up with you on that. And then get in touch with us, and we'll help you navigate that question. It's also a reason to continue the conversation, to extend the conversation. Public policy work can be scary to some people. It's not. It's just 2 folks having a conversation. You don't have to be the professional policy wonky person. All you're doing is having a conversation and saying, look, Representative McCullough, I know that this bill's about to hit your committee. I would appreciate a good vote because this is why it's important, X, Y, and Z. And it's important to me because here's my story. I lost my grandmother to suicide in 2005, and I've been working ever since to help reduce the stigma and increase access and work to access to mental health care and work to lower these suicide rates. It's as simple as that. Becoming a resource. So build your relationship year round. If you are only going to your elected officials with your handout, it works, but you're always more effective if you create that year-round relationship. Send emails. Their emails, I'll show you how to find their emails. Engage them on social media, Twitter, tag them. But again, when you're doing this, make sure, like Leader McCullough said, that everything stays diplomatic. We are a nonpartisan organization. We don't get down to who's on what side of the aisle. We're nonpartisan because suicide affects both Democrats and Republicans and independents and libertarians. Nobody's immune. So we as an organization have to take whatever our partisan blinders are that we have on. Sometimes we have to take them off. We don't wear a color. We're not red or blue. We are suicide prevention advocates and experts. Make one-on-one visits. Don't be afraid to email your elected official and say, hey, I'd like to schedule a time on Zoom to discuss what you're about to see in committee or what vote's about to come to the floor. A lot of them have local offices. Stop in, schedule a meeting to come in and have an in-person meeting. Town halls or community meetings. These are so important. Legislators do this throughout the year, and it is an easy way to be able to have FaceTime. A lot of times in Arkansas, especially in the more rural areas, there's not many people that attend those. So you're going to have one-on-one time with your legislator at those meetings. Always subscribe to their newsletters because that's going to tell you what's important on their legislative docket. And then testifying at hearings, like I said, either in writing or verbally. So let me see if I can share this other screen because I want to show you. I hope most of you know who your legislator is. If not, I'll give you a website to go to check that out here shortly. So I'm going to stop and start again. All right, are you guys seeing the Arkansas Legislature website? Okay, good. All right, so here you can search for bills. If there's certain legislation, and we're going to give you these bill numbers, you don't have to go search for them. You can put this up, and it'll show you exactly where in the process it is. Remember that flow chart that we saw where it's introduced, goes to committee, full floor vote, then introduced to the other chamber. This is where you're going to be able to monitor and see a bill's progress in real time. If you want to find your representative, right here, I'm going to put mine in. And there it is, Representative Tippy McCullough. And you'll see here her terms, her leadership roles, anything that's been happening in the news. And then her email address is right here, click contact. And there's her email and there's her phone number. It's that simple. All right, let's get back over to the presentation. So identify sponsors of suicide prevention is where you can see if once you search that bill, you can see is your member listed as a sponsor for this legislation. If not, guess what? Click contact, find their phone number, get their email address, text them, call them, send them an email saying, look, this is important, and try to get them to sign on as a sponsor for the bill. So we've talked about how a bill becomes a law, and then we just looked at the ARCLEG website. I encourage you, if you're going to get in deep with this work, that the ARCLEG website is the way to go. AFSP resources. So public policy is a huge priority for the American Foundation for Suicide Prevention. It's one of the 4 arms of AFSP. Check out the website. Like I said, go to afsp.org/advocacy, and there's tons of information there about how you can get more involved. Now, I want to watch. We've been talking about how to schedule a meeting with your elected officials. Now let's take it one step further and let's see what a meeting might actually look like. Okay.
Want to make a difference for suicide prevention and mental health? Want to get the attention of your public officials? Want to save lives through advocacy? Here's how. Public officials listen to their constituents, and that's you. Advocating for suicide prevention is easier than you think. So get ready to take action, advocate, and save lives.
When advocating at the state and local level, and sometimes at the federal level too, you may have the opportunity to meet with your public officials. Today, we're meeting with Council Member David Grasso.
Get organized. Have the materials you plan to share ready. You must be on time to your meeting. Early is better. Decide who is leading the meeting before you get there. Practice sharing your story out loud. You might want to do this in front of a mirror or with a trusted friend or family member. Keep your story to 2 to 3 sentences, 30 seconds or less. Decide what you are asking for and how you are going to ask for it. Collect yourself before the meeting. Calm those butterflies, and now you're ready to advocate. Introduce yourself. Thank the council member for meeting with your group.
Council member, it's great to see you again. Taylor and I are here today representing the American Foundation for Suicide Prevention for our first ever advocacy day here in the district. So thank you so much for taking the time to speak with us.
Well, it's my pleasure.
Ask how much time for this visit.
How much time do we have today?
I have
thank the council member for previous support, if applicable.
It just means so much to me, both personally and professionally, that you introduced the Youth Suicide Prevention and School Climate Survey Act back in 2016 to require educator training in school policies and suicide prevention. For leadership, for being a true champion on this issue.
Share your personal story. Ask other group members to briefly share their stories.
I've been with the foundation for about 10 years now, since losing my brother to suicide. He was in high school when he died, so it just means so much to me.
So I'm also a field advocate, and I have a number of family and friends who struggle with their mental health and with finding the necessary resources.
Share the AFSP national and state fact sheets and underscore that suicide is preventable. State there are steps the council member can take to support prevention efforts and share the talking points and legislative needs.
As you can see here, suicide is the 15th leading cause of death in Washington, D.C., the 10th leading cause in the country, but we know it is preventable.
Which brings us to our two asks of you today. The first bill would require regular training for health professionals in suicide assessment, treatment, and management.
And the second bill we'd like you to support would address suicide prevention on college and university campuses. We've also included some language for a resolution making September Suicide Prevention Month, if you'd be interested in introducing that this year.
That's great. I really appreciate the advocacy, and obviously I'll look closely at your materials. In fact, I'll be happy to put you in touch with my staff as well to make sure that they have your contact information and you have theirs to work on these bills as well as perhaps introduce the resolution. So thank you.
Request to take a picture with a council member if time. Give folder to the council member, shake hands, and be sure to say thank you for their time. Write down notes from your meeting so you can report back to the AFSP Public Policy Office. So that wasn't so hard, was it? Your AFSP advocacy does make a difference, whether it's on the local, state, or federal level. Start planning your meetings with your public officials now. The AFSP Public Policy Office is here to help you along the way.
All right. Are you guys seeing the presentation again?
Yes.
Okay. So see, it's not hard. Basically, you're telling your story, and when you pivot from a story to an ask, it makes sense. You're not just going into asking out of the blue. Another thing that makes the advocacy work that we do different and probably more effective is we're there because it's important to us. We're there not because we're a paid lobbyist. We're there because we have experience that brings us to that meeting. So share that up front. I don't know if you saw, but one of the ladies, one of the advocates in the meeting had a button with a picture of her brother and his name. Totally fine. The more you can bring your personal experience into these meetings, the better. You guys, if you're having questions, you can always put it in the chat or write it down, and we can go over it later. All right, so what are we working on right now? This is the fun stuff, the exciting stuff. So priority number one, how many of you, I'm sure most of you, celebrated with us back in 2020 when Congress passed the National Suicide Prevention Lifeline Improvement Act? What we know is that these lifelines work. They provide timely and effective and efficient care when someone is in a suicidal crisis. So if we know it works, what do we need to do? Make it work better, put money into it. You know, we've been saying for, a long time ago, whenever I would start having these meetings, legislators would say, well, yeah, but how do we fix this? And my answer would always be, I wish I had that magic bullet. I wish I had that silver bullet. And while the lifelines are not a silver bullet, they sure go a long way to providing that timely and efficient and effective care for those that need it and when they need it. So when the feds passed that act, it also designated 988 as a shortcut. It asked the FCC to create that shortcut, just like if you dial 911, you get emergency services. If you dial 988, it's not implemented yet, but coming out, when you dial 988, it will go directly to the National Suicide Prevention Lifelines call center here in Arkansas. And we're really fortunate here in Arkansas. In fact, we're the first and only state in the union that decided that a call center was priority enough to fund it and house it inside a state agency. No other state has done that. They answer anywhere from 1,000 to 1,400 calls per month. So Arkansans are taking us up on it. They're using this call center, and it's helping that many Arkansans. So what are we going to do? When the feds passed that legislation, they punted it down to states on how to actually implement this 988. So yeah, there it is. Senate Bill 2661 became law. It is landmark. It's historic for us in the suicide prevention community. So where we have been, where we are, and where we're going on the implementation of 988. It has been a long time coming that we've been working on this in DC. It is currently law. It has 500 days to be implemented as of today, actually. So we're working with the FCC to figure out the logistics. We're working with some of your telephone providers about how to logistically make it work. And again, this has to be live in 500 days. Now, something interesting that we're working on, we're hoping, the federal legislation allowed for states to have a small surcharge on your phone bill that would fund these call centers and make sure that they have the capacity and the tools that they need, and the staffing and the technological tools to do what they need to do and do it really well. Many of you probably have never noticed a little 911 surcharge on your phone bill. It's going to be exactly like that if we can come to agreement. It's a very, very tiny amount, as little as a nickel. So so we're working on that. Stay tuned on this. This is one of those where I'm going to ask you to be watching your email, sign up as a field advocate, because we anticipate this legislation to be introduced in the next few days even, and we're going to need your advocacy. We're going to need you to reach out to your elected officials and talk about how important this is. Here in Arkansas, the Lifeline is currently funded just by excess trauma funds. Well, that's not sustainable. This funding source would make a stellar call center sustainable for Arkansans throughout the future. Priority number 2, expand access to behavioral health care. We can never get enough of this. This bill's actually already been introduced. It's House Bill 1176. So if you want to find out, if you want to follow up on the progress of this bill, go to that ArcLeg website and put in HB 1176, and it will show you the process. In fact, let's, where are we on time? We're a little long, but I'll show you House Bill 1176. Come on. Okay. HB 1176. There you go. You can see where it was introduced in the Senate right here, and it was referred to the Public Health, Welfare, and Labor Committee in the Senate. It actually came from the House. I'm sorry, it passed the House House committee, passed a House vote, and now it's in Senate committee. And you can see that process right here. So that's a little bit about how to effectively watch the progress of a bill as it's becoming law. All right, so this, as you can see, as a result of COVID-19, the DHS issued several memos authorizing certain reimbursements for behavioral and mental health services provided via telemedicine for the time period of the public health emergency. We think and we've seen telehealth work. You know, the questions I've gotten sometimes are, you know, have we seen suicide rates go up during COVID? I've heard language, very unsafe language, like suicides are skyrocketing during the pandemic. Well, that's not true. That's just not true. What is true, however, is more people than ever are seeking mental health treatment, one type or another, which is a good thing. We'll take it. So what we're asking in House Bill 1176 is that this policy be made permanent, that this reimbursement that providers get for providing telehealth stays part of our healthcare modality, mental health care modality throughout for the future. So super important. Priority number 3, this one is about student IDs. We are working with Representative McCullough, who we think is going to lead on this issue, to talk to the state about if you are an institution of higher education and you issue a student ID, on the back of that ID somewhere needs to be some type of suicide prevention resource. It can be right there where the students can pull it out. Think about that transition when a student leaves home and goes to college. Or graduates high school and goes to some type of institution of higher education. A lot of things are happening right there. They're stepping away from their adolescence, pretty much, and they're becoming, they cross this invisible threshold, and all of a sudden they're supposed to be an adult and they're supposed to have their stuff together. And while also walking away from all the support, the community support, the family support, the nuclear family support that they had while living at home, and walking onto a college campus a lot of times where they're starting over and building new networks of support. That time is critical. So we want every student of higher education in Arkansas to have that resource, a suicide prevention resource, more than likely the text line, at their fingertips at all times. So we're looking forward to successful and clean votes on that. Again, stay tuned, watch for field advocate alerts or field action alerts as they come out. So what do we do now? Email your legislators. Go to that website, afsp.org/action center. Sign up to be an advocate. It's going to automatically match you to your elected officials that will be considering these votes. Tippy's point was really important, though. Whenever you get a field action alert that it's time to contact your elected official, there is a form letter that's on there. But Tippy's advice was invaluable. Don't just click send and send the form letter. Write your story in there. Keep the content of the form letter, but write why it's important to you. Talk about your story. Schedule a phone meeting. Like Representative McCullough said, they're eager to talk to their constituents. They want you to be involved in the governmental process. Again, share your connection, engage your community by recruiting other advocates. If you are going to, let's say you scheduled a meeting with your member of the House. Well, guess what? You probably have some friends who think that's pretty important too. Get them in the call too. Get them in that meeting too. And then be sure and use our tags when you're on social. All right. One thing that was in that video that I think we need to highlight again is tell your elected officials it's time to end suicide now, and it is preventable. You'd be surprised how those of us who do this work day in and day out forget with the top line message. Suicide is preventable with your help and your partnership. Call your legislators, introduce yourself, that they will remember your name after about the 4th phone call. Utilize the issue brief that you received in the email yesterday, I believe, and you'll probably get some updated ones as new things come out. Highlight one issue. Don't go in and say, well, I want all 4 of these bills. I want your support on all 4 of these bills, sponsor them all, vote them out of committee. Pick one that you're passionate about. Or if we tell you, hey, today we really need your action on the 988 legislation, focus on that in your conversation. And then always send a thank you letter. it is, you've heard it forever, but it works. It's another opportunity for that elected official to see your name. Always offer to be a resource. We've said this, and Representative McCullough said it. Say something like, hey, I want to be a part of this conversation. This is important to me. And they will take you up on it. So in the next couple of weeks, you're going to start getting these action alerts. You're going to get emails from us regarding this legislation that's about to hit the floor to go into committee. We will give you further instructions. We may even have a follow-up training on how to schedule these meetings with your legislators. If you want us to be in on the meetings, we will do our best to make as many as possible. Then you'll complete that legislative feedback form that you'll get in an email, and then send a thank you email. There is my contact information. Tyler.afsp@gmail is a great way to reach me. Keep me in the loop. If you're emailing your legislator, copy me so that I can be a part of that conversation. I'll also share my phone number in case you guys have any questions. It's 608-501-3386. One more time, that's area code 608-501-3386. All right, before we get to some Q&A, well, actually, let's go ahead and open it up to question and answer. I'm going to stop sharing my screen, and if those of you on Facebook or if you're watching via Facebook, feel free to chime in the comments while we're still live. Wendy, can you unmute everybody? Nope, I just asked.
I'm sorry, I missed it. What?
No, I was just saying everybody can unmute. We're going to have just kind of a discussion and answer any questions that you guys have. Feel free to pipe in, and you can ask it live, or you can put it in the chat. But as everybody starts to unmute themselves, I want to thank everybody for being here again today. We're going to wrap up here shortly. But are there any questions for me or the policy team or the chapter leadership for Tabitha?
Tyler.
Yes, ma'am.
I wondered why the push for the call center number on IDs. Why just at the college level? I would like to see that on high school name tags too.
Yes, so that is part of the discussion, actually, Sheila. I'm really glad you brought that up, because that was not every high school issues state IDs. I mean, student IDs, I don't think, but the language could say something like, for every school that does, this needs to be on the back of their ID. So yeah, that's something that Representative McCullough and her colleagues and I have been talking about. It is in the model legislation. We are doing our best to avoid any kind of pushback.
Yeah.
So we're not taking the path of least resistance, but it's a step in the door. We'll probably look to amend that to include any high schools that do issue IDs.
Okay.
Great question.
Tyler?
Yes.
When is a good time to start working on legislation for the next legislative session, which is year after this next one? I mean, how long is the time frame that we need to?
So great question. The session normally starts, the general session normally starts in late January, sometimes early February. These conversations need to have started the fall before. But again, we talked about having a year-round relationship with your elected officials. They shouldn't be surprised whenever you come to them and say, hey, we're gearing up for this session. This is important to us. What do you think about this idea? So again, that year-round conversation and relationship is really important. But if we're talking about, if we're talking about ideally, we would like to start having these conversations in November and December, so that in January it's not a big surprise.
Okay, thank you.
Any other questions?
Tyler, I don't have a question, but my name is Rachel York, and I'm from the American Indian Center of Arkansas. And we actually just are starting our new program called Native Connections.
Yeah.
Which is a suicide prevention and mental health and substance abuse program geared towards Native Americans, adults 24 years and younger. So the overall message of suicide prevention is, of course, throughout the whole state of Arkansas, but the actual services, too often Native Americans are they kind of fall by the wayside and are kind of forgotten. So I'm very happy to be a part of this program to where it helps those Native Americans receive the mental health services that they need.
Yeah.
Suicide.
Are you guys based here in Little Rock?
Yes.
Okay, Rachel, you and I should get together. You're doing really, really important work. I'm glad to hear about that. And I'd love to learn more about how we as an organization can support your mission.
Sure. Yeah, I definitely, I have your phone number down and I have your contact information. So I look forward to getting with you soon.
Perfect. That's great. I'm glad you're here, Rachel.
Thank you.
Anybody else? All right. Well, as I said, more to come in the next few days. It's about to get really, really busy with some of this mental health and suicide prevention legislation that we are very optimistic about getting done before the end of this session. So sign up to be a field advocate at afsp.org/advocacy. That way you'll be the first to know whenever we need you to support this the legislation when it's introduced. So you can see Wendy's contact information there. Wendy Thompson is our area director. Her phone number's there. Write that down. If you can't get me, you can always reach Wendy. For upcoming events, we've got AFS-PINO on March the 20th. Wendy, do you want to jump in and talk a little bit about these?
Sorry, I was just typing my contact information. Yeah, the first event is our very first AFS-PINO event. It is a wine education class, and there are different ticket levels based on what you're interested in. We also have some wonderful raffle items, so be sure to register for that and join us. And hopefully next year we'll be able to do this in person, but it'll be fun virtually, so please join us. We also have our campus walk coming up April 24th. It will be a virtual program, and we are encouraging everybody, students and community members, to walk in their neighborhood or a park safely. And you can register for that at afsp.org/AR campus. And then we also have Hike for Hope coming up on May 22nd. It's going to be a wonderful, fun way to support suicide prevention and get out and get some exercise. That's going to be at Pinnacle Mountain State Park. All of these events are on our website at afsp.org/Arkansas. You'll be able to see all of them there, in addition to all of our upcoming programs. We have a great Talk Saves Lives coming up. We also have our new program, Gizmo, that we are rolling out. We're so excited about. So check out our website for all of that information, or you can always email or contact me by phone, whenever works for you.
Definitely. So as you can see, AFSP, the Arkansas chapter, is not slowing down. We're not letting COVID slow us down. We are going full steam ahead. So I encourage all of you to get involved. That Volunteer 101 is a great way to get started and learn about AFSP and find where your sweet spot is in the organization. There's lots to do, and there's a place for everybody in the organization. So check that out and sign up to be a volunteer. All right, without any, I think that wraps everything up as we talk about these events. Thank you guys so much. We're right at an hour. So thank you guys so much for being here today, for being passionate about suicide prevention and really taking the step to get involved in the policy making process. We cannot do this alone. We need our governmental partners, and this is how it happens. So thank everybody for sticking around this evening. Thanks for being here. I'm going to stick around for a few more minutes. If anybody wants to hang around and have a conversation, I'll be glad to do that. Otherwise, thank you. Everyone have a good evening.